Good evening. Welcome to our webinar series. We are very excited to be taking a session at our Consumer Medical Symposium, which was in March, and making it virtual. My name is Rich Bazzillo. I am NEHA's Executive Director, and I am here with a great panel of experts that will be sharing about their experience with trauma and mental health. So, trauma and mental health was a topic that we really focused on at our Consumer Medical Symposium. And this journey that you're going to be on for the next 45 minutes to an hour will be sharing stories. We know sharing stories is the ultimate connection and the ultimate of independence and acceptance of having a bleeding disorder. And each person here tonight is going to be sharing a little bit about their journey. So as I mentioned, this is about an hour long. If we don't go the entire hour, we'll go as long as we can. You do not have to have your camera on. You can have your camera off. If you have questions as they come up, we ask that you put them in the chat so we don't interrupt the panelist, and then we'll read the questions either when the panelist is done or at the end. But this session is really intended for patients and caregivers to share personal stories and experiences navigating the emotional challenges that come with caring or living with someone with a bleeding disorder. This received really positive feedback in our survey, so that's why we are bringing this important conversation virtually so that more members of the bleeding disorder community can have it. So with that said, I'm really excited, and I'm going to spotlight her to introduce Ann Henningfeld. If you've not met Ann before, she is a ball of energy. Is just about to start another camp after coming off of training as we start our family camp next week. But Ann comes from a plethora of background, years, decades of experience, and we're really grateful that she moderated this group at Consumer Med, and she's going to be doing it tonight. So Ann, I'm going to pass the baton off to you.
Thank you so much. I'm excited to be highlighted. Good afternoon, good evening, and welcome. Again, my name is Ann Henningfeld. I'm your panel facilitator for today. I just really wanted to start by acknowledging the courage that it takes for our panelists to be here, who've agreed to share pieces of their lived experience, and also for you as an audience, opening your hearts to stories that may have reminders of what your own experience is like, and just choosing to enter into a conversation that can touch on the emotional stress and trauma connected to life with a bleeding disorder. So, just being here, all of you that are here, and any of you that are watching later online, your presence is an act of strength, and I want to acknowledge that. So, the purpose of our time together. To learn from each other. We have a wide range of experiences here. I love personal stories. I learned so much from them, and I'm excited to hear what we have here. To open a dialogue that's grounded in trauma informed practice and to create a space where people can share their stories, feel seen, understood, and less alone. So, sharing today or asking questions in the chat, totally optional. Witnessing, listening, and being present is more than enough. So I also just wanted to set a few expectations so that we can maintain a really supportive and non-judgmental safe space. What is shared in this Zoom stays in this room and stays in the Zoom. Now, this may be shared out to the wider NEHA community, but the stories are not to be told by other people. I want the stories to stay as the stories of the people who are telling them. So just because we hear the story doesn't grant us permission to repeat it. If you are really inspired by any of these stories, do direct people to watch the recording. I think that's just an essential piece of trust. And as we listen, we want to listen with openness and without judgment. Take what resonates with you and leave the rest. Just want to be mindful that everyone's experience is their own. And so that is so helpful in just listening. Also, it's completely normal if you have any emotional reactions to what you hear today. Trauma lives in the body and it can show up in a lot of ways. So, tears or jitters, tightness, restlessness, all of those responses are welcome. If at any point you feel overwhelmed, pause, take care of yourself. Send Rich a private message if this is getting overwhelming, right? Send him a private message and he'll be able to set you up with some people who might be able to help because, of course, your well being comes first. And with that, I'd really like to begin by introducing our panelists. I'm going to introduce each panelist, and then I'm going to go back to the beginning and start with some questions. So our first panelist today is Shanti Hegde, a young adult who moved from Georgia to New England to attend Northeastern University, where she graduated in 2025. She's now pursuing a master's in public health at Brown University and has chosen to stay in the Boston area in part because of the exceptional care she's received for her rare bleeding disorders. Shanti brings both academic insight and lived experience to our conversation today. Our next panelist is Jeff LeBlanc, a physical therapist from Massachusetts living with severe hemophilia A. Jeff is the father of 3 young children under the age of 5. His dual perspective, both as a clinician and a lifelong patient, adds a valuable dimension to the discussion that we're going to have today. And our final panelist is Carolyn Miazga, the mother of 2 boys with hemophilia and a member of NEHA's board of directors. Carolyn holds a PhD in biology, a background that has helped her navigate the complexities of hemophilia despite having no family history. She brings deep insight into early diagnosis, the realities of raising 2 children with different bleeding patterns and different personalities, and the ongoing demands of caregiving while navigating the challenges of her own mental health. So I want to get started today by asking each of our panelists to share a bit of their story. Shanti, in reading the article about you in the Brown School of Public Health Student Spotlight, which I did a little research ahead of this, I was really struck by how long it took for you to get your diagnosis. I would love to hear more about your journey to getting diagnosed and the impact of the journey itself. I know it took a really long time. And so, yes, there are a lot of steps along the way that it took you to get there, but I'm really curious about the impact, not just physically, but emotionally and psychologically on the length of that diagnosis. And I'll turn it over to you now.
Thank you so much, Anne, for that wonderful introduction. Thank you so much for having me and highlighting my story. I'm so honored to be here with all the other panelists who also have really incredible and also have had to go through so much with their bleeding disorder diagnoses and also as caregivers. But kind of going on my story, I was diagnosed at 19 with my first bleeding disorder, and I was diagnosed at the age of 21 with my second bleeding disorder. I live with 2 bleeding disorders, von Willebrand's disease and factor 7. Pretty much all my life, I was pretty much bleeding. When I was young, I remember bruising a lot, but I remember my pediatrician kind of chalking it up to the fact that I was just a kid who is playing outside, is active, is bumping and bruising different areas. I had nosebleeds as a child. And also, like every time I would get an immunization, my arms would swell up, as well as I started around the age of 11 having chronic knee pain, to which they attributed as growing pains, but my kneecap would swell up a lot and it would be very painful. And so I kind of always had joint, muscle, and just overall a lot of bleeding problems as a child, that was never really just kind of brushed up to the fact that I was a child. Up until I was in 5th grade, I think I was either 10 or 11 at the time, and I started my period. And I was having really, really heavy periods that lasted for 4 to 6 months straight, ever since I pretty much started bleeding at the age of um, 10 or 11 to throughout middle school. I remember when I was in 8th grade, I had to go to the hospital for the amount I was bleeding, and for the pain I was feeling with the blood. I was just feeling really lightheaded. I was anemic, because I was bleeding 6 to 8 months straight, pretty much in 8th grade onwards. And so I was then referred to an adult OB gynecologist. I grew up in Georgia, as a little bit of background. I grew up in North Georgia, where the healthcare system is not super great at all. I was never seen by a children's not oncologist, children's hematologist, children's OB gynecologist. I was never seen by a children's doctor other than my pediatrician. I started off at the age of 13 by seeing an adult OB-GYN, because that was the only doctor that was near me that specialized in heavy bleeding. And so I started seeing this OB-GYN who pretty much was just really confused on why I was bleeding so much, put me on birth control at a really young age, at the age of 13. And I had been on birth control, pretty much every form of birth control, by the age of 18. I had been on the pill, I had been on the patch, I had like tried pretty much everything. And it came to a point where my OB-GYN had pretty much exhausted every option, and said, let's see if you have endometriosis, because that's the only thing I can think of. Prior to that, my OB-GYN sent me to physical therapy to see if that would stop anything. And then said, you know what, let's cut you open and see if you have endometriosis that might be causing all this bleeding. So December 2020, when I was 18, I got the endometriosis surgery. And from January 2021, from December 2020, right after I got the surgery, which then was January 2021, to August 2021, I was bleeding on and off. And from August 2021 to May 2022, I bled through straight every single day. And that was my freshman year of college. I moved from Georgia to Northeastern University in Boston. And I had pretty much bled through so much. I was missing classes. I was losing a lot of weight. I remember just feeling lightheaded all the time. I was sleeping all the time. And on came the spring semester, and I remember dropping out of some of my hard classes. Like, I was supposed to take general chemistry. I ended up dropping out of it just because I couldn't guarantee I could go to lab, go to class. And so May 2022 came around the corner, and it was time for me to move out of my freshman year dorm. And I remember moving out, and I was bleeding so much that I was attempting to go to a Target to help get stuff to try to move out, cleaning supplies. And I remember passing out. And I was then taken to Brigham and Women's Hospital, where I saw an OB-GYN, who for the first time asked me in May 2022, have you heard of a bleeding disorder? After hearing all of my history. And so I was then subsequently tested for von Willebrand's disease and hemophilia, and they found out that I have low von Willebrand's factor as well as factor VIII, and they subsequently sent me to a hematologist in July 2022. I was sent to a hematologist, and that was when I got my von Willebrand's disease diagnosis. And I was really confused. I was really excited that I finally had a name for all the bleeding that I've gone through, because I remember telling my mom, remember when I would just literally in high school stand in the bathtub and just gush out blood, because the pads and tampons weren't helping holding in the blood. And I was really excited, but at the same time, I was like, what does this mean for me? Like, is there a medication option? Is there a treatment option? What does this mean? And I, for the first time, got a desmopressin challenge, which is the first line of treatment for von Willebrand's disease, for any surgical or any other heavy menstrual bleeding episodes, or any other bleeding episodes. And so I got the challenge in August of 2022, and I anaphylaxed to desmopressin. I had a severe allergic reaction to it. And I remember being in the ER after I got EpiPen twice, and was thinking, I literally just got diagnosed with von Willebrand's disease, and the doctor said this may be my only option. I was just depressed thinking about it, because I thought, I finally got a diagnosis, and my body really had to go and reject the one therapy. And so then they tried two antifibrinolytics. They tried Amicar and tranexamic acid, and I could not tolerate them, to the point where I was having GI bleeding episodes. And so they questioned if my GI bleeding was from the antifibrinolytics. And so in December, they decided to do a colonoscopy. And I got the colonoscopy for the first time ever in my life. And for the first time also ever in my life, I got a dose of Factor in December of 2023. And that kind of changed everything for me. I didn't bleed from my GI tract for the first time in a while. My colonoscopy was clean. There was nothing wrong, no underlying issues that could have caused the GI bleeding. So ruling that out, that it was really just the antifibrinolytics that was really causing the upset stomach. So they stopped that. And I like went into my doctor and I started advocating for myself. Like, this was really interesting that I didn't know factor was an option for me. I didn't know that they could change my life that much. And they did say that it wasn't really an option. They would only give it to me in emergency situations. And so from December 2023 onwards, I was still bleeding a lot. I was still having my periods 4 to 6 months. I was still having, every time I got a vaccine, I couldn't sleep on my left arm because it would swell up. I was still having problems. And so I ended up going to a lot of NPDF conferences and a lot of like local, I heard about all these local resources. And people kept telling me to advocate for myself, and advocacy was key. And I never really knew how to do that. I think that was a really hard, and still is a really hard part of my entire care, just because culturally, that's not something that we do. Culturally, coming from a South Asian background, that is something that we're told, doctors know everything, doctors know what's best, and kind of treat doctors like God. And so I didn't really know how to push back from a perspective of a patient and advocate for myself. So I was really trying to learn how to do that. And so in the spring of 2020, or the fall of 2020, fall of 2023 and going into the spring, I was bleeding a lot, and I approached my hematologist, who said, okay, maybe at the time, my hematologist at the time, who said, maybe we can try factor once a month, whenever you're on your period. And so we tried that, really wasn't working because of the half-life being so short. It was barely working for me, and I was still bleeding a lot. And I kept pushing back. I kept being like, well, if you don't think that I'm bleeding because of my von Willebrand's disease, and you don't think my bleeding is anything, then could you test me for other factor deficiencies or other disorders? And my hematologist at the time said that it would be a waste of blood to test me for other disorders when she knew that it would come back negative. And so I kind of kept pushing after that. And there was one day where I had an infusion, an iron infusion, and it didn't really go so well. I had a reaction to that. And I kind of was really fed up because my care team kept blaming other things rather than my bleeding. And so I remember calling my care team, first the nurse. I remember seeing the nurse who said, um, that she's seen much worse bleeding, that if I don't get an IUD, I should get an IUD. And if I don't get an IUD, then I want my bleeding disorder. And that really just ticked me off. I was not happy at that at all. I was being dismissed. And so I went to my hematologist at the time and I said, listen, I think there's something wrong. I'm still bleeding. And the hematologist, and I kept asking the same questions of, there's something wrong. I don't know what's wrong. Can you test me for other things? I think there's something wrong. And she said that my questions were not great, and it kind of indicated to her that I had depression and that my anaphylaxis was not anaphylaxis, that I was just anxious and should be put on anxiety medication. And she also told me that she's surprised that I'm even pre-med because of all the questions I was asking. They're not questions that somebody that is a biology major or wants to go into medicine should ask. And that if I wanted to be a doctor, I needed to have retention, and I'd have retention issues. And so basically calling me stupid. And so I decided I had enough of her. Um, and I was kind of in a really bad place after this. I was honestly, like, from this interaction with a doctor who I really respected, honestly, who I really looked up to. I thought, I'm gonna give up. Maybe I just stay with her and I let her treat me, and that is that. But I was like, I deserve better treatment. So I pretty much called every other hemophilia treatment center near me. And the responses I got were, we're going to put you on the wait list, or we can't really see you right now because you are not severe enough. And at this time, I was only diagnosed with von Willebrand's disease. So I was pretty I felt pretty dejected after this, just because I, I hated to hear that I wasn't severe enough, so they weren't interested in me, so they were going to put me on the wait list, or that they didn't have enough room for someone that didn't have severe hemophilia. And so I called pretty much, I exhausted all my options, and I called one last hospital who wasn't an HTC, and they got me an appointment in 2 weeks. And so in the middle of May in 2024, I saw a just general hematology oncologist at Tufts Medical Center in Boston for just a second opinion. That I thought I was just going to take the second opinion and maybe find another doctor at an HTC, and maybe wait at the wait list. But it turned out to be really great, because the minute I started talking about my symptoms, the minute I started explaining myself, and I actually came in with the second appointment with my elbow swollen 2 times the size. They immediately took me seriously and immediately started me on prophylaxis of factor and started testing me for other factor deficiencies, which I was like, wow, I didn't even think this would happen, but it did, which was incredible. And that's when I got diagnosed with factor VII deficiency, and found out I had another bleeding disorder, and my bleeding phenotype was severe. But that took a lot of advocating and was really just exhausting, and was just a lot mentally, for sure.
Absolutely. Wow. What a story of perseverance, though, to be honest. Um, I'm so impressed, especially, you weren't particularly old. You're not particularly old at this point either. But to be able to push through, um, many of us know how difficult it can be to do anything when we're feeling terrible, and continuing to advocate for yourself. It's exhausting, right? So I really feel like I got a really strong understanding of the emotional toll just listening to your story. Thank you for being so thorough and clear with what it meant, not just physically, but what it meant also emotionally. I'm hoping as we get toward the end, I'll come back with another follow-up question. But at this moment, I am going to, if it's all right with Jeff, move on to him, our next panelist. I had the opportunity to watch Jeff work with our NEHA teens at Be Leaders about a year ago, and it was just obvious how deeply his own childhood experiences growing up with a bleeding disorder really informs the way he connects with young people now. And Jeff, I'm wondering how those childhood experiences with hemophilia, the home infusion, the interactions with other kids in hematology oncology, how has that impacted your emotional journey today and into parenthood?
Yeah, love to elaborate on that. First, thank you to Neha, and thank you, Anne, to for setting this up and emceeing it. Yes, my name is Jeff. I live with severe hemophilia A. I am a physical therapist, so had lots of physical therapy as a kid, and that kind of shaped where I went with my career and try to give back at this point in my life. So I love what I do, super passionate about healthcare in general. Stories like Shanti's are really inspiring. And as a healthcare practitioner, it's upsetting at the same sense. And you still see it. It's everywhere in healthcare, and there's a lot of different reasons for it. It's you could chalk it up like bad. There's bad practitioners, there's bad plumbers, there's bad um, mechanics and things like that. But I think it's a kind of a systemic issue in healthcare. So hopeful that things change in the future. But really amazing story of perseverance and in a sense of I have a daughter as well. She has my genes, so we'll see what kind of bleeding she ends up with. But it's people like Shanti that kind of can blaze a trail for females going forward. So really great stuff. But so my story, I was the second in my family born with hemophilia. I had an older cousin, and so we knew it was in the family. I was born in '88, so fortunate to miss a lot of the bad blood years. It was still going on late 80s, I think, but I was just lucky to not have that as my treatment option when I was born. Um, and prophy wasn't a thing then, so as severe A, hemophiliac, a lot of my bleeding was into my joints. Super painful. Couldn't walk. I had both ankles as my target joints in my right elbow. So like as a kid crawling or starting to walk and things like that, I would have bleeding into those joints. And then as I got older, running around as a kid does, you'd have ankle bleeds. And I think that the topic of trauma, I think even just having a bleed that keeps you from doing the things you enjoy is traumatic. You watch your friends playing and you're just kind of sitting at home in a lot of pain, having to get stuck with needles and things like that. Um, but one specific instance that when Rich said, "Oh, I want to talk about trauma with your bleeding disorder," I really have a vivid memory of being held down for my first at-home infusion. Um, they needed one person per limb, so I think it was my mom, my dad, and then my aunt and uncle holding arms and legs. Um, and I can think back, it almost felt like an out of body experience. I think other people may share that with trauma is like I almost like floated up above and saw like me down there. And then I was like, well, I guess this is what we're doing now. So, but previously, so that was, super traumatic in that sense. I just think having it done at home was going to be very different. I think I started that at 8 years old because that's when we were going to start Profi, and we weren't going to go to. I was seen at Tufts Floating Hospital at that time, so we weren't going to be going to Tufts to get, my, Profi 3 times a week. So it had to be at home. But prior to that, I had been stuck hundreds of times, up to that point, and never reacted that way prior to receiving a needle. So, um, and I touched on this at the talk last time, but that was a testament to the other side of healthcare. Really good practitioners, good nurses, make you feel comfortable, and that's what you want in healthcare. So, I think the other side of that too is Tufts was a heme oncology as well, pediatric hematology oncology. So, you're there, and I got hemophilia, so I got my joint bleeds. I'm getting my infusions and things like that, and then you also see the really sick kids. That's kind of had its own kind of traumatic presentation as well. Seeing these kids in that state that are my age. So it was, in a sense, it provided a lot of perspective at an early age. Um, so I think that kind of helps in a mature, like early maturity. What the meaning of life, and perspective and service and all that stuff. So, um, it shaped who I am today. I'm kind of grateful for those experiences too. And now as a parent, um, I watched my sister go through this with her son. He has severe hemophilia A as well, and kind of helped her along the way with how should you when should you do the infusions and some tips and things like that. And I think there's no easy way to do it. I think the day that I mentioned that out of body experience, I was probably just having a bad day as an 8-year-old. And then, so yeah, I think waiting for maybe a good time or a good moment in the day, or, incentivizing them for afterwards, like a treat or an activity or something can be helpful for that. But yeah, it's challenging with kids and having to give them their shots, and takes a lot of patience. And yeah, I mean, I see it now with my kids, just putting a band-aid on them or having to touch their boo-boos or something. So it's hard for me to be like, I want to be like, come on, like you see me do my needles on, but that you can't put that on them. You have to meet them where they're at always, and work with their current state. Um, yeah, but so yeah, I think just having a bleeding disorder presents a lot of trauma. So um, things like this are great. Talking with loved ones is good, but also, finding some professional help is good as well. So,
Well, that leads perfectly into my next question, Jeff, honestly, for you, which is what do you think when you think back to, that one very specific memory or the memories of seeing those other kids in the oncology ward, or even the trauma of just not being able to participate when you want to. When you think back to those, what do you think has helped you the most in your journey into adulthood to help process or integrate those traumatic childhood experiences?
talking with others.
Great.
I have two cousins with it who are close to my age, so we leaned on each other a lot. And then getting involved with, NEHA, and talking with other people that I wasn't related to or didn't know, and you can share experiences. And um, yeah, I think that's probably the most helpful for sure.
Yes, absolutely. Well, I really appreciate that. I think that the community that you're involved with and seeing how active you are within the community, I absolutely see that as a step toward, sort of integrating your own childhood and your own memories to be able to give back and to advise your sister, I think is just such an amazing thing to be able to use that perspective. And there are some things that I was thinking about you as you're talking about your own kids and what it takes to treat them. It really leads me right into where I think I'm going to go with Carolyn. So I am going to move on to Carolyn. I think we're going to be able to come back for a second round of questions with Shanti and Jeff. But I'm going to really want to move into Carolyn because she does bring that perspective of taking care of kids in that area. So I'm very pleased to bring Dr. Carolyn into the conversation now. We have heard from two patients on different journeys, and now we're going to turn toward that caregiver perspective. Carolyn, you have been an open and vocal advocate for mental health in the bleeding disorder community. I am curious about how Aiden, your son's diagnosis with no family history, impacted you in the face of all things postpartum. And how was that different from your experience with Andrew, your second child?
Yeah, absolutely. Thank you so much to Anne, and thank you to my co-panelists, Shanti and Jeff, for sharing your stories. I think we're doing some good work here, so I really appreciate what you've been through. And so, as you mentioned, Anne, my struggles with mental health. I've never kept a secret. I was diagnosed with generalized anxiety and panic disorder when I was in college. So this is well before bleeding disorders came into my life, but and then subsequently OCD. And so control has like been a very important part of like just how I relate to my world. And with my first son, as you mentioned, I had no family history of a bleeding disorder. So it was absolutely, I did not see it coming. I can remember vividly the day I went into labor and excitedly timed my contractions and um, drove to the hospital with my husband. And everything was going as expected. About 12 hours in, we discovered he was breech, and that led to a C-section. And that was, I thought, okay, well, not part of the plan, but here we go. That's how it's going to come out. And during that time, I was feeling anxious, but I trusted that like I had done all the right things, right? Like I had taken good care of myself, and I had the prenatal testing, and we had every indication that everything was going to be okay. So I just had to get through this like somewhat scary surgery, and we'll be okay. Um, Within 2 hours, I had him in my arms, and he was perfect in every single way. I remember being in my hospital bed, just snuggling him, nursing, doing all of the things. Um, One thing that kind of was a little bit surprising, I noticed some blood on my hospital gown, and he had been bleeding from his heel stick. And we thought, oh, a little odd, but I confirmed with the nurses he got his vitamin K shot. So I thought everything was going to be fine. This was just a one off. So this was on a Thursday. Saturday morning, he was circumcised. And at that point, I knew I would be at the hospital at least until Monday. So everyone, the family had come, seen the baby, got their snuggles in, and went back because everyone traveled from a distance. So they went back home late Friday, early Saturday morning. So at that point, it was just the three of us again. And we went in for the circumcision. Everything went smoothly. And the nurse came in to check on him after he was brought back to me. And she's like, oh, I'm just going to check, make sure everything looks good. And without any indication that anything was wrong, she's like, you know what? I'm just going to have the doctor take a look. Everything looks fine. Bring him to the nursery, and I'll bring him back. And again, I thought nothing of it. About maybe an hour later, the doctor came in and said, he's oozing from the circumcision. We need to. She lied, but she said he was oozing. I can only imagine what she saw in the diaper when she checked him, but she so the doctor came in, said we need to try some other things to get the bleeding to stop. And they tried a few things throughout the day, and it was becoming apparent that something wasn't right. Did some blood work, PT and PTT came back um, abnormal. They were extended, and they started asking questions. Do you have any history of a bleeding disorder? I'm like, no. Nothing like that. But at that point, they realized that there wasn't anything more that they could do for him at the hospital that I delivered at. So this was about an hour north of Boston. So he was transported to Tufts Floating Hospital, and they would continue to take care of him there. The downside is that I had had major surgery, so I couldn't go with him. So he was transported late Saturday night, and I was stuck in the hospital. They wouldn't discharge me. I wasn't ready to be discharged. So my husband went down to Boston to be with him. We got eventually to the point where the blood work was done and confirmed that he had, I was told he had severe factor VIII deficiency. No idea what that meant at the time. I just had a baby. I had all the emotions, all the things going through me. And finally, someone said the word hemophilia. And as a scientist, I was like, that can't be right. I knew the genetics. I was like, I have no family history. And what does that even mean? Like, it means that, what we learned in genetics class is, they have trouble clotting. Other than that, I knew nothing. So I spoke to the hematologist over the phone, not his ultimately the one who would care for him, but spoke to a doctor, and she said, yes, he has severe hemophilia, and maybe he'll grow into something less severe, but for now it's severe. And I had all kinds of questions, but most importantly, being alone in the hospital, I thought, oh my gosh, what just happened? How can I do this? My anxiety and the desire to have control over something that I clearly had no control over, really set in. And the doctors helped me through sleep medication and helped me with pumping to be able to provide a milk supply for the baby because it was so important to me. Um, Ultimately, by the time I got to the NICU on Monday in Boston, he had gotten pretty lazy. He would let a bottle just empty into his mouth. He wasn't even trying. So it was something. But yeah, he needed factor. He needed blood. He received a transfusion. He received factor. Um, and ultimately, he had surgery to repair the wound. And I was discharged with the baby about a week after I had given birth. Um, I had a wound to take care of, and I had this baby that I thought could break by just looking at him. So it was quite the experience to navigate, just learning what it meant to be gentle and what would cause a bleed, what wouldn't cause a bleed. And it took a long time to feel comfortable with that. But with the support of my own care team and Aiden's care team, we finally got to a point where 3.5 years later, we decided it was time to try for another baby. And so I went through the same thing essentially, but knowing that hemophilia was a possibility. I knew I was having a boy, but I didn't know if he would have hemophilia or not. But we planned. Again, my planning came into play here. But I planned to deliver in Boston, so this way he would have the care he needed should there be something wrong. But I was doing all the planning. I had the C-section set up and scheduled, and all the doctors were going to be there. I had care for Aiden. My husband would be there with me, all of the things. And I welcomed Andrew into the world on February 4th, 2016. And he was diagnosed with severe hemophilia. I saw it coming, but the surprises that ensued were I didn't see coming. I had a history of anxiety. I took SSRIs during pregnancy, and he was experiencing what they believed to be withdrawal. And so he displayed seizure-like activity that required a CT scan, which came out clear. And so they chalked it up to the withdrawal from the medication I had taken during pregnancy. But then he spiked a fever, and he needed a full septic workup, including a spinal tap. So he needed factor. So all the planning that I had done it felt for nothing, but thankfully everything turned out okay. Um, and then I was diagnosed with postpartum preeclampsia. So I was put on magnesium, which if you've ever been on, is not a pleasant feeling. Um, and I couldn't be alone with the baby. So all in all, both experiences, I saw hemophilia coming. I didn't see it coming. It taught me that can't control everything as badly as you want to. But both experiences were equally traumatic in different ways.
So that helps me when you were talking about your care team and Aiden's care team and balancing the two. I guess that's my big follow-up question for you is how do you balance both caring for yourself and your own physical and mental health needs with caring for a family? I have a ton of respect for that, but how do you do it?
Super challenging. I went to school for a really long time and super, super educated. And I left my job to be home with my children. But in the process of doing that, I made like the ultimate mistake of like giving up myself entirely. And it has taken years of therapy, of just really examining what do I want out of life and what's important for me and how do I take care of myself so I can be my best self for my kids. And that's been a tremendous challenge and something like I'm still working on. I haven't perfected it, but I'm trying new things. I'm trying new activities. I'm exploring leisure in my life, thanks to you. But just really, absolutely, doing things, putting myself out there and taking care of myself, whether it's activity, exercise, eating well, taking my own health, physical health seriously, mental health seriously. I'm not ashamed. I had to ask for help, and that has improved the quality of my life so much. So it's so important to ask for help, and to be open with people who can provide that support.
Love that. Thank you so much. It was so fun to hear you talking about taking your tennis lesson and that you've gotten into pickleball. This was a little pre-session conversation we had, and I love to hear that because you're absolutely right. Not letting yourself disappear into that, I think, is a really important part of staying healthy and doing the things you're asked to do. I'm going to circle back to Shanti because I didn't get to ask her a follow-up question, but as I've been listening and reflecting on your experience, I heard you tell the story of having difficult interactions with providers, but I know that you're really happy with the provider that you have now. And so I guess my question is, in your experience, what do you think is key to a strong patient-provider relationship?
Yeah, definitely open communication. I think a provider who's willing to listen to you and who's also willing to talk to you about what they're comfortable with and what they're not comfortable with is really key. And feeding off of each other's ideas. My newest provider, my current provider, we basically just whenever I have a issue or something comes up and I have questions, I come in with just a list of ideas, and we kind of just go through them together. And my provider, like every time I ask a question, even if it's the smallest question or if it's the question I've asked over again, doesn't really make me feel afraid to ask that. And I think if you feel like you are feeling afraid or you're feeling like you're not getting taken seriously or they're kind of brushing you off, I think that breaks the trust. And I think someone that you're just really you trust and you feel comfortable talking about some of the issues you're having. And I've literally brought papers to my provider and asked questions, and he's been excited and enthusiastic about it rather than shutting me down. And that's really what made me build trust in my provider. Especially since I have a rare factor deficiency, that can be really key because finding a therapy for me has been kind of hard. And so my provider gives me a platter of options every time I'm like, okay, so this therapy wasn't working for me. He kind of goes off and gives me like a whole platter of options rather than telling me there's only one option. And that's something that I really like, and something that it feels like I'm in the driver's seat and I'm making the decisions, and I have the decision to make on what therapy I want to be rather than a provider being like, you only have one option. If not this, we're done. And I really appreciate that. And that really helps build trust for me personally.
That's wonderful. I so love that you have that relationship with your provider. I saw a provider not too long ago and I took in a PubMed article and she was like, rare when we have patients bringing in studies. I was like, oh, I just had questions. And she's like, no, I love it. And I thought, and that made me know that I was in the right place, right? When she came to me with, oh, I love that, it made me feel like I was absolutely in the right place. Those are the kind of conversations I hope everyone can find a provider who is able to have those kinds of conversations. Well, we're coming up on the hour, but I wanted to provide both opportunities for anyone in the chat, to throw some questions in there, although I haven't seen any yet. But I also wanted to open to our panelists if there's anything else that you think you really want to make sure that you add or say before we wrap up today.
I just want to build on that point Shanti brought up about communication. Your doctor and provider relationship is just like any other relationship, and communication is the most important piece of it. I've been a PT for 11 years. I train students here, clinical students. I take on new grads and train new PTs. And You could do all the cool techniques and cool exercises in this PT world, but if you're not communicating with your patient and you're not on the same page, then it's not going to go well. I have patients come in to see me all the time and they say, I tried PT in the past, it didn't work. I'm like, what? PT just doesn't work. Like, what went wrong with the situation? It's all about communication and usually a lack thereof. And as a provider, I feel I'm putting my energy into getting this person better. And I want them to come to me with questions. That's how I know they care about getting better. So I think that's how you know if you have a good provider and a good relationship going, is if you can ask questions and they're listening, and that's what makes it work. So great stuff.
Well, I love that. I love that.
Yeah, I can add to that, and that communication is so important. I had two kids, or have two kids, they have very different bleeding patterns, and me being like open and talking to their hematologist, to kind of understand like what that meant, like that helped me to navigate the path the second time around, but also like it helps me I look at them each in very unique ways. And that helps me be a better mom. And it helps us when we have a problem, me get like the information that the doctor needs, to her more, quickly and effectively, so that we can, get a solution on board quickly.
Terrific. Terrific. Shanti, any parting shots for us? Any last pieces of wisdom? I gleaned a lot from all of your stories.
I guess a kind of unique perspective I've seen, especially in healthcare, is I've lacked a lot of trust from providers not being culturally competent or competent in terms of how to deal with people of different skin tones, especially because my bruising patterns are completely different because I do have a darker skin tone. It's honestly a lot harder to see a bruise on me. And I have providers that have basically brushed it off, being like, that's because you're brown, because it's just hyperpigmentation. It's not a bruise. And I didn't really know how to tell what a bruise was until pretty recently. Honestly, this year actually is when I started finally realizing what a bruise looks like. And I think that, at least for me, like that has had more of a mental impact for me than actually just living with my bleeding disorder. Of just like the microaggressions I faced in healthcare, and providers not really having that cultural competence, which is really important, especially in trust within having a provider or patient relationship.
Yes, absolutely. I see. Um, I see a couple of comments here. Melissa says, I've been told that since I'm so white, that's why my bruises are more visible, but that it's normal. It's because she's white, that those are normal bruises, which is so funny. You got told because your skin was brown that that wasn't bruising and that that was normal. Very interesting. I have a really nice question here from Katie that says, I'm in a state where our adult and pediatric hematologists are together. Any additional tips to advocate with with my doctors? They made me an emergency care plan. They claim they mailed, but never did. Thankfully, I had a friend print it for me. But if you were to give maybe each one of you, one of your like top tips for that you have learned over the years for advocating. I think my top tip is I printed out an article. So that's probably one of my top tips. But if each of you has something that you have found that has worked really well for you, I'd love to hear.
I guess I can start. I'm a very non-confrontational person that has like slowly started turning a little bit confrontational. And that has kind of helped me. It is very awkward, but it has helped me or helped improve relationships with my providers. And I don't have this problem with my hematologist, but I've had this problem with my rheumatologist where they'll do things behind my back and not tell me. And I've point blank said, my insurance literally pays for me to see you. I would really prefer if we kept this relationship like an open relationship in terms of us communicating. If you have if I ask for something like, can you please communicate with me? Just because in Georgia, especially a lot of my providers in Georgia, they are really bad at communicating. They don't answer their phones. They like really just are terrible at telling anything or even writing. Like I had my pediatrician never wrote a single thing down, and I don't have any of that information from when I was little. And so just really making sure, like, if they're not listening to you, making sure, like, telling them, document this. I want this documented. I want this in writing. Even email the clinic to make sure, like, you have that in writing. At least you did the outreach, so that if, like, push comes to shove and you are required to go to another doctor and they start questioning you, or like you go to another doctor in that practice. I've had this problem where I go to another doctor in that practice and they question me on if I made an effort. I can pull up receipts. First of all, that's not a great question. Maybe you shouldn't see that provider, but at least you have receipts to show the clinic. You have receipts to show anyone that questions you. So really just like, if you feel like you're not being heard, or they're going behind your back, like make sure that you document every mode of communication, whether that be like emailing them, whether that be like even like asking to record your visits, having someone else come with you, or writing things down, and even like emailing your doctor after your visit. Here's the visit summary from what I have. So that or even like take a social worker. I didn't even know you could do that, but the social worker will definitely advocate for you. So I definitely would suggest starting to document everything so that you have a case. And if you have to complain, you can send that. I didn't even know this either, but recently I found out you can complain and send things to medical ethics boards. So you can send that if they're not being communicative and they're not actually providing you good care. You can have that all documented to send that to a medical ethics board.
It is a wonderful time in which we live, in terms of electronic medical records. And, Stacy pointed out in the comment that providers can see all the messages that you send through portals on the back end. And those have been, I think that's a wonderful way, now that we are coming into a time. I don't want to see a doctor that doesn't have an electronic portal for me, right? Like that's where I want to be at this point. And I think it's good all around from the patient point of view and the provider point of view. I wanted to highlight your idea of bringing a friend with you. I had to get a very difficult diagnosis in 2020, and I wasn't allowed to bring anyone with me. So I brought someone on my phone. I said, "This is my friend, and she's with me on this." And I FaceTimed throughout because she's not afraid to ask things. I too get intimidated by a doctor. You just got to find a friend who's not intimidated. Make your list of questions ahead of time, and then they don't let you leave until the questions are done. And I'm super grateful. That's a friend I met through the bleeding disorder community. She's a woman with von Willebrand's disease who goes to all my doctor's appointments with me virtually because she's not afraid. So that's my best tip, to find someone. Jeff or Carolyn, do you have tips as well?
I mean, I have patients coming in and have to deal with orthopedic doctors who, there's some really great ones out there, but there's some really kind of egotistical, poor communicators, and they feel like they don't have time for you. So I'll tell them, write your questions out on a paper, have it on your phone, just stand in front of the door and hold them hostage until they answer your questions.
I love it.
So it works because unless they're an absolute, lots of words for them, and they just tell you to get out of the way. At that point, I doubt that would happen. But yeah, stand in front of the door and don't let them leave until they answer all your questions.
I love it. Great tip. Carolyn?
And I was just going to say, I am relentless in my pursuit of information. I call, I send messages on the portal if I can't get through to the phone. If I have waited the 48 to some more hours than that and I haven't heard, I call again, whether it's an insurance company, a doctor, a pharmacy, squeaky wheel sometimes. I don't want to be a pain, but it's my way of advocating, like to let somebody know that this is really important. Like I'm not calling because, I chipped a nail. I'm calling because my son needs his factor, or I'm calling because there's a problem. And so that would be, yes, relentless pursuit of information.
I love it. I love it. Well, here we are, just a little past the hour. I think this has been a wonderful conversation. I could do this any night of the week with all of you here, and I specifically have a big heart for the NEHA community. I wanted to say, on behalf of Rich and everyone at NEHA and the community in general, thank you so much. Thank you to our panelists for your bravery and your honesty and your openness. That's what makes this community so special. I just thank you from the bottom of my heart. And I couldn't be happier with the way this has turned out in this conversation. So good to see you all again. I'm glad we got to have a reprise. And those of you that have joined and those of you that are watching us later, I hope this was helpful and healing and hopeful for you as well. And with that, I will say good night to you all. Thank you so much. Thank you for being here.